You're listening to OET Roleplay Practice with Kev, the English native.
Hello, it's Kevin here. Welcome to another podcast for OET Speaking Practice. So we have another nursing role for today. This is based on OET.com official card number 3. This is one about the teenager who's managing exam stress and panic attacks, etc. Okay, so this is quite an interesting one. So as you listen, you can also take a look at the transcript, link for the download below if you're listening on Spotify. Well, you'll have to, because that's the only place you can listen to it. So you can download the transcript. It's a verbatim script, the nurse's lines, the patient's lines, and more importantly, the criteria annotated and mapped out to show you how it works, how it fits together. Okay, so just have a listen and see what you think. All the guides there, how to use it. You've got the script, you've got the roleplay cards. Just have a listen, get some good phrases, and more importantly, understand how the criteria are mapped. A, B, C, D, E, showing empathy, reassurance, incorporating patient's perspective, etc. All the things that I've mentioned before. Okay, hope that helps.
Hello, my name is Tammy. I'm one of the nurses here at the Community Health Centre. Thanks for coming in today. Can I just confirm your name and age, please?
Yes, I'm Kevin, 18 years old, in my last year of high school.
Lovely, thank you, Kevin. I understand you've been having some panic attacks recently. Could you tell me a bit more about what's been happening?
Well, it usually comes on quite suddenly. My chest feels really tight, I get sharp pains, and it feels like I can't catch my breath. My hands start trembling and my heart races really fast. It's actually quite frightening.
That does sound very distressing. When these episodes happen, how long do they usually last?
Around 20 minutes, sometimes a bit longer. And when it's happening, I just feel like I'm losing control.
I can imagine how unsettling that must be. Have you noticed anything that seems to trigger these attacks? Or do they come completely out of the blue?
I think it's mostly connected to school. I've got a really important exam in about 2 months, and every time I think about it, I feel this huge pressure building up. Sometimes the panic comes just while I'm studying, or even at night when I try to sleep.
That makes a lot of sense. Exams can create a huge amount of stress, and the body often reacts physically to that pressure. Just so you know, Kevin, what you're experiencing is actually a normal response to high stress. Your body goes into fight or flight mode, even though you're not in any real danger.
I was worried it might be something more serious, like maybe a heart problem.
I understand why you'd think that. Chest pain and a racing heart can be very alarming. But based on your age, your overall health, and the way you describe the episodes, this is consistent with panic attacks brought on by stress, not by a serious illness. You're not alone. Many students in your position experience the same thing.
That's a bit of a relief, but it still feels awful when it happens.
Of course, and I don't want to minimise how unpleasant it is. The good news is that panic attacks can be managed, and there are several strategies we can try. Would you like me to share some ideas?
Yes, please.
All right. First, when you feel an attack coming on, try to move somewhere quiet if you can, even stepping out of the room for a few minutes. Then focus on your breathing. Take slow, deep breaths in through your nose and gently out through your mouth. It helps to count each breath to keep your mind focused.
Okay. That sounds simple enough.
Another technique is visualization. Closing your eyes and imagining a calm, peaceful place, like lying on a beach or sitting in a park. That mental image can help reduce the panic.
I could try that. I usually just sit there panicking until it passes.
That's very understandable. But giving yourself a tool to focus on can make it feel more manageable. Also, day-to-day habits matter. Things like getting enough sleep, eating regular meals, and taking breaks from studying for some exercise can all reduce the chances of attacks starting.
I haven't really been sleeping well. Sometimes I stay up late revising, and then I feel exhausted the next day.
That could definitely make the symptoms worse. Your body and mind cope better with stress if you're well rested. Setting a regular bedtime and taking short breaks while studying can actually help your revision as well.
Right, I'll need to work on that. Is there
Anything else I can do if it happens suddenly?
Yes, one useful trick is grounding yourself. That means focusing on things you can see, hear, or touch around you, like naming 5 objects in the room or feeling your feet on the floor. It brings your attention back to the present moment and away from the panic.
That sounds interesting. I'll give it a go.
Great. How do these strategies sound to you so far?
They sound practical. I'm willing to try them, but I might need some help sticking with it.
Absolutely, and you don't have to manage this on your own. What I'd like to suggest is that you come back here once a week for the next few weeks. We can practice relaxation and breathing exercises together, and I can check how you're getting on.
Weekly visits actually sound like a good idea. I think having that support would help me feel more confident.
I'm glad to hear that. Before we finish, let me just summarise what we've discussed today. Your symptoms are linked to exam stress rather than a serious illness. Panic attacks are common in situations like yours and can be managed. The strategies include breathing exercises, visualization, grounding techniques, and healthy routines like sleep and breaks. And we'll arrange weekly sessions here at the centre so you have continued support.
That all sounds clear. Thank you. I already feel a bit more reassured.
You're very welcome, Kevin. You've done really well talking about this today, and each step you take will make you feel more in control. With practice, these attacks should become easier to manage.
So, I hope you found that useful and interesting. Like I say, that was number 3 in the nursing cards. I've done 3 cards for medicine and 3 for nursing. I'm going to try and do at least 1 card a week each. Making these audio files is interesting process. I have to use AI text to speech, and then I've got to do all these other things. So it is a bit time consuming. However, I'm going to do the best that I can. I hope you find these useful. You can contact me on italki. Just go to italki, search for Kevin A. Dean, or just if you go onto Google and you put in Kevin A. Dean, English teacher, italki, you'll see all my stuff, my YouTube, my podcast, etc. Anyway, hope that helps, and I'll try and do another one for next week. Well, hopefully. Okay, then. Bye for now.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.